My name is Catherine Lowe. I'm an interventional cardiologist for Jackson Heart. I joined the practice in 2022 and I treat general cardiology, coronary artery disease, and heart failure. Coronary artery disease, also known as heart disease, is where you have narrowing of the heart arteries that supply blood flow to the muscle. That oftentimes develops over years to decades. It's slow, is undetectable until symptoms occur. And what it is it's a buildup of plaque within the heart arteries. This is secondary to cholesterol development, and over time that hardens into calcium. And that is what causes further narrowing of the arteries and overall the disease process. Anyone is at risk of developing coronary artery disease. Your risk increases though if you have certain risk factors such as high blood pressure, high cholesterol, obesity, diabetes, if you smoke, or if you have family history of a first-degree relative, such as a parent, sibling, child that had premature development of heart disease, meaning they were younger than 65 at time of diagnosis. Your genetics at that point will put you at increased risk of developing the disease yourself. A lot of times it is not diagnosed until you have developed symptoms. That is why we are trying to provide additional education so that people know the risk factors and know when to be screened for it. But oftentimes we see patients who are developing symptoms of heart disease, meaning that the coronary narrowing or the narrowing of the heart arteries has occurred enough that it's restricting blood flow to the muscle and causing symptoms such as chest pain, also known as angina, shortness of breath, increasing fatigue. Those are the classic symptoms that we see when presenting. At that point, we will diagnose you with either a calcium score or a CT scan of the coronary arteries. That allows us to see plaque development within the heart arteries and whether or not it's significant. If you are considered high risk, meaning you have a bunch of risk factors that we've already discussed, we may proceed with stress testing, such as a nuclear stress test or an exercise stress test on our treadmill, to allow us to see if you are having symptoms of coronary disease. So the main treatment option, whether or not you need an invasive procedure or non-invasive, is lifestyle modification and medication. So if you have been diagnosed with coronary artery disease, step number one is to change your lifestyle. So that includes healthy diet, so a diet that's low in saturated and trans fats, less processed meat, less processed food overall, and heavy on fruits and vegetables. More of a Mediterranean style diet is the first step that we want you to take. Next, we'll prescribe medications, likely aspirin, and then cholesterol medications such as a statin therapy in order to bring your cholesterol levels down. Now, if you're currently having symptoms of heart disease that are concerning, then we'll proceed with what's called a left heart catheterization. What that is an invasive procedure where we go in either through the wrist or the groin and take pictures of the heart arteries from the insides using special wires and catheters. At that time, if we do find blockage that is significant, we can then fix it with either stents, balloons, or if it's a lot of disease, you may be better served having open heart surgery. But that is a decision we make after our initial assessment.